Coronavirus testing in the U.S. What you need to know. How does the coronavirus test work? If you've tried to get tested for coronavirus in the United States but have been turned away, you're not the only one. As the country grapples with the rapid spread of the coronavirus, tests have been frustratingly hard to come by. But testing is now starting to ramp up. Experts say testing as many people as possible for the new coronavirus is crucial to slow the rate of infection, or flatten the curve. Public health officials rely on testing to find hot spots of the disease, identify which communities are most at risk, and track how widespread the disease is. Once someone knows that they have the virus, they can self-quarantine and stay away from other people. A community effort called the COVID Tracking Project estimates that the country has so far processed close to 100,000 tests as of March 19. That estimate is still far fewer than the 274,000 done in South Korea. What's being done about the testing shortage? On February 29, the U.S. Food and Drug Administration issued a policy to help expedite the availability of more tests. The policy gave U.S. labs permission to develop and validate their own coronavirus tests without waiting for approval from the FDA. In response, diagnostics companies Roche and Thermo Fisher announced that they would begin manufacturing and shipping millions of tests to help alleviate the shortage. Commercial labs like LabCorp and Quest Diagnostics are making tests available, too. Many university medical centers have also developed their own tests and are quickly trying to ramp up the number of tests they can process daily. These efforts could dramatically increase testing availability soon. Do I need to get tested? Initially, the CDC recommended testing only people who had symptoms, fever, cough, and shortness of breath, and an obvious exposure to the virus. But on March 4, it changed the criteria to include anyone displaying symptoms of COVID-19, regardless of any known exposure, as long as they have a doctor's order. The CDC recommended testing for people who had symptoms, fever, cough, and shortness of breath. If you have mild symptoms but are young or otherwise healthy, a health care provider may tell you to stay home and rest. Older adults, people who are immunocompromised, and those with underlying medical conditions like heart disease, diabetes, and lung disease are being prioritized for testing, even if they only have mild symptoms. I think I was exposed to coronavirus. How long is it going to take for me to test positive for the virus? We don't know the answer. But if you get exposed to the coronavirus, symptoms can appear anywhere between 2 and 14 days afterward, with a median of about 5 days. Where can I get tested? The CDC recommends first calling your primary care doctor or regular health care provider, who will ask you certain screening questions to determine whether you should get tested. Right now, most patients need a doctor's order to get a test. Your doctor's office can't perform the testing but can recommend a nearby testing location. How does the coronavirus test work? At most testing locations, a health care worker will swab the inside of your nasal passage for a sample of cells. Then your sample will be sent to a lab for processing. The tests developed by the CDC, diagnostic companies, and academic medical centers all use a routine lab technique called a polymerase chain reaction, or PCR, to confirm the presence of the virus's genetic material in your cells. PCR works by amplifying the tiny amounts of genetic material from a nasal swab into large enough quantities that can be analyzed. If the virus's genetic material is found in your cells, then you are infected with the virus. How soon will I get my results back? It varies. It could be as soon as 24 hours or up to 4 days, depending on a few factors. For those with mild symptoms or no symptoms, it may take 3 or 4 days to get results. How much will it cost me to get tested? Congress passed a coronavirus relief package that makes testing free for all Americans.